Hello, my name is Marcela Gonzalez, and I'm an ideal nursing student, and I am redoing the IV video intake because the first one, my face wasn't fully shown in the video. And how much space or option to do anything, so with my tablet, I'm having to like shrink down so you can see everything I'm doing. I'm here to show you skills of how to do the IV insertion and discontinuing. Supplies that I have here are my gloves, the normal setting for flush, the 18 gauge syringes, the tape to bandage over. Also have the IV tubing as well, and the tourniquet, which I don't think I have because I throw all my other supplies away. Anyhow, we'll just pretend like I have a tourniquet because I don't have an extra one here. They only gave me so many supplies, and I apologize for that. So first thing I'm going to do is I'm going to get the orders from the doctor, sanitize my hands, read the orders before I go into the room. I'm going to get the patient, verify the patient's age, name, date of birth, and allergies, inform them on what we're going to be doing, and what we're doing, and how we're doing it, and walk you through the steps of how to place an IV. So, wash my hands, check the orders. Looks like patient's here for a dehydration issue. We're going to place an IV for IV hydration, and then monitor electrolytes and fluids. Okay, so sanitize my hands. Knock, knock. Hi, Mrs. Smith. My name is Marcella. I'm one of the nurses today helping you today. Looks like the doctor wants to place an IV in your arm to get some IV fluids in you because looks like you seem to be a little dehydrated. Are you okay with that? Yeah? Okay, great. Have you ever had an IV placed before? A long time ago? Great. And how was your experience with that? Good, good. All right, so I just have a few supplies here. If you don't mind, I just wanted to check name badge, verify your name and date of birth. Mrs. Smith, 9497. Perfect. Alrighty. No allergies and medications? No, perfect. Alrighty. So I would grab the tourniquet. I'm going to assess your arm area, check for vein area, okay? So what I'm going to do is I'm going to perform hygiene, and then I'm going to apply the tourniquet. So we're going to pretend this is a tourniquet. We're going to tighten it, not too tight here, okay? Okay. And then I'm going to inspect the area for an appropriate vein. Okay. Okay, and then I'm going to inspect and palpate to any where there's a straight vein and gorge vein where I'm able to have a good IV access into there. Okay, so I have my notes here. And then I'm going to release the tourniquet. Let that rest a little while. I'm going to put my gloves on. Okay, the gloves are kind of hard to put on. Oh my goodness. Inside out or whatnot. I don't know if these are backwards or whatnot. Anyhow, I'm going to put my gloves on. I'm going to grab the clean the site with for the Clorox wipe here. I'm going to, okay, Mrs. Smith, I'm just going to clean the air for a little cold touch. Okay, and let that to air to dry. Then I'm going to reapply the tourniquet. Pretend that I have a tourniquet here because I don't have one with me. Reapply the tourniquet, okay. And then I'm going to hold the area down between my first finger, my thumb here, middle finger and thumb here to secure the vein. I'm going to apply the tourniquet. I'm going to insert the venipuncture with my needle here that I have here. Insert the venipuncture in here. Okay, I'm in the vein. All right. And then I'm going to make sure the bevel's up when I go in. It's going to be a 30-degree angle. Okay. And then I am going to, once the thing is in, I've got the IV, the fluids are running through that I could see we got a flashback. I'm going to take the tourniquet off. I'm going to remove the needle out. Okay, and I'm going to grab my IV tubing. I'm going to make sure that I'm priming it here properly. The end, clicking it off. And then I will attach it to the IV insertion here. We're going to pretend like it's an IV insertion here. With this one here, the needle here, because I don't know how much supplies. I'm going to attach it here so it's attached, okay? And then I'm going to anchor it down below 34 degrees angle, inch, and then click and release the needle when I pull out. Okay. And then I'm going to flush the normal saline in and grab the, I'm going to release, and then I'm going to do the prime venous axis, make sure it's priming properly, right? Like I said, attach the IV priming fluid, which is here. Flush. Okay. Looks like everything's flushing back properly. Okay. No pain, nothing noted? No. Okay, perfect. All right. Okay. All right. And then I am going to, once I apply that off, everything's on there, I'm going to apply a clear dressing. We're going to pretend like this tape is a dressing over the secure spot. The needle's already gone. This is in place. We're going to take the IV tubing down. I'm going to attach the IV bag up to the pole there. And then, so patient is now receiving her IV fluids. No redness, no swelling, no complications of IV insertion or any kind of swelling or redness around the area to show any problems with IV insertion. And then, so leave that in place here. Say we take it down. Let's get a piece of tape here. Okay, we're going to place some tape now. Okay, we're going to remove gloves. Pretend it's tape on there. And hygiene, wash hands. Say, okay, Mrs. Smith, everything's in place. We're going to go ahead and set the pump. 100 miles per 100 rate per hour, 1,000 miles per hour, whatever the order is the doctor order. For example, I'm going to wash my hands and leave the room. It's been about a day or so. She said IV fluids. I'm going to come back in, do the same process, wash my hands, introduce myself, verify the patient's name and date of birth, Miss Smith, 9497. Miss Smith, looks like your fluid hydration is doing a lot better now. Doctor would like me to remove your IV. Are you okay with that? Perfect. All right, shouldn't hurt a bit. Get some more gloves on really quickly here. Pretend like these are new gloves. Limited supplies. I'll go with the same thing too. I'm going to go in and to remove the IV fluid. I'm going to hold down to secure the site area. I'm going to remove the tape. And remove any of that. I'm going to make sure that I have an alcohol swab. Pretend this is an alcohol swab or a gauze to hold down here over the area. I'm going to pull out the needle towards me at a certain angle here. I'm going to apply pressure to hold down for a few seconds to prevent any excessive bleeding and make sure that the blood clots properly. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10. And then I'm going to take that out of there, and we're going to pretend like this has a gauze in there. We're going to put a bandage over it. Going to stabilize it. All right, Mrs. Smith, how you feeling? Okay? Good. All right. We're going to go ahead and continue to monitor your lab. Make sure the fluid intake is properly done and you're nice and stable before you go home today. I'm going to go ahead and remove my gloves. Wash my hands. Also sanitize. Document what I did with the insertion and the discontinue IV fluids. I'm going to document everything. The last amount that the patient was fluid was taken in intravenously and communicate with the provider. Ask the patient if she has any questions. If she has any questions, just tell her, okay, great, the doctor will follow up with you. Thank you so much. Please let me know if you have any other complications. Thank you. Go and leave the hand, wash my hands, start, document, and complete the rest of the process. Thank you.